Make their way back in. We'll get started here.
I can hear your mic. Thank you.
Do I have? Yes. Okay. So, Krista and Sara are colleagues at American Economic Liberties Project, and they've written, I think, a series of articles for the American Prospect and other outlets on concentration. They wrote one article in particular that I think just tells a really great story about all the issues that we're talking about today. And it's called Healthcare's Intertwined Colossus. Highly recommend everyone take a look at it. And, it's about United Health. And, I think just to get to the highlights here, I want to ask, in the piece you say, United Health is on a path to creating their private single-payer system, which is kind of in line with what we heard in the first panel. It was like, we're going to have a duopoly in this whole space. And there's so much in the piece. We can't get to it all, but I would love for you both to just walk us through the highlights, tell us the story about, like, the evolution of United Health.
Okay, I will start, and then Sara, you can fill in any of the gaps that I miss. But yeah, this was really just a history of how United came to be the largest healthcare provider. And it really dates back to the 70s, kind of late 60s, when the HMO Act was initially introduced. And a lot of that was a response, at least that we found, to the introduction of Medicaid and Medicare, where people were realizing there was no pressure on doctors to minimize costs. And so initially the HMO Act was only to be, like, HMOs were to be managed as nonprofits, but the creation of United was to get around, like, skirt around the nonprofit law or kind of restriction and manage these HMOs. It ended up rolling a bunch of HMOs up, and then it shifted that roll-up strategy, as many people have said today, kind of they've used acquisitions to grow into various business lines. So starting with HMOs, then traditional insurers throughout the 90s got bought out by them. It then shifted into data collection, and where all these databases that were nationally used for reimbursement rates kind of fell into the control of United. And most recently, physicians' practices, which have led them to be the largest independent physicians owner. But that roll-up, they've taken a swung at almost every branch of healthcare, and at various points has been to lean into what is intended to restrict the entrance of corporatization, but has very quickly, and again, as people have mentioned today, fallen into kind of, okay, we're just going to rely on United to deliver pretty much every service we have.
Yeah, if I can just fill in a few points there. So United Health today, I think most people think of it as the largest health insurer in the country, and in addition to being the largest physician employer, which makes it riddled with conflicts of interest, as Krista was saying, it also is one of the largest pharmacy benefit managers. It owns one of the largest health banking institutions. It currently, I believe, is the second largest provider of health savings accounts. And so it has its influence in all of these different pockets of healthcare. And now other big insurers like CVS, Aetna, Express Scripts, and Cigna are copying its model. And so, Teddy, as you were saying, in terms of United Health almost moving into this single-payer or universal healthcare system, but just completely run by United, that's what we're seeing.
And you guys walk through not just the HMO law, but other policy developments. Can you talk about some of those in the story of kind of how United Health evolved? I mean, right, like at the very beginning, they were not even an insurer. Like the insurer was kind of added on later through acquisitions. So just, how the law intertwines with the how United Health became a conglomerate. I mean, maybe if you can talk a little bit more about that, that'd be great.
Yeah. I'll start with the idea of managed care, and then Sara, if you want to get into Medicare Advantage. But so initially, as I said, with the HMO Act, it was really to kind of allow for physicians-owned management, but with their salaries being determined by the whole pool of money that was collected previous to the year. So the more that they spent on care, the lower their salaries were going to be. But it was this, again, nonprofit model. So they weren't looking to profit off of that practice. Once United came into the picture through Richard Burke, there are really two main characters in our story. One that I wish I had written more about, Paul Elwood, who throughout various decades until the early 2000s had a ton of influence in the ways that the government understood the healthcare system and how it should be regulated. So from a shift where people recognized problems with health maintenance organizations, they kind of pitched this idea of managed care in the early 90s. And Paul Elwood, who again worked very closely with Richard Burke, kind of created this group called the Jackson Hole Group, where every couple of years they would bring in, initially it was a lot of academics. It quickly became kind of the heads of the largest insurers. So the head of Cigna was there in the early 90s when managed care was being pitched and when Clinton really ran with it. So I would say, while I don't think he or either of them are evil per se, they definitely had a very optimistic view of the ways that the corporate understanding of healthcare should influence regulation.
A few additional ways that United Healthcare's growth has intersected with policy and law. A huge change was in the 1990s when the government basically started allowing pharmacy benefit managers and plus other healthcare providers to essentially start taking kickbacks, which had been illegal under the anti-kickback statute. But because of these exemptions, now the PBM industry was allowed to essentially take kickbacks from drug makers, which, as those who are following what's going on the Hill right now might know, legislators are very active in trying to reform this because it's been known to increase drug prices. And so that has driven a ton of revenue and profits to companies like United Health that currently run one of the biggest PBMs. So in addition to that, there's been a major expansion over the years in Medicare Advantage, primarily through the 2003 legislation under the George W. Bush administration. And United Health today is the largest contractor for Medicare Advantage. On top of that, during the Obama administration, the Democrats pledged to reduce funding to the Medicare Advantage program because of all of these allegations of overspending. Instead, amid a huge lobbying blitz, the Democrats reversed course and decided to add even more funding than was previously planned to the Medicare Advantage program, which went on to benefit companies like United Health that contract with Medicare Advantage. And so, this was sort of a very interesting through line that we noticed while we were reporting out this piece, is how all of these policy decisions that were made, Democrat and Republican alike, basically helped to create what United Health has become today. And so a lot of what we're trying to think through now as policy analysts is how they can reverse course.
In your story, you also talk about United Health, and this was really surprising to me, buying a policy shop, the Levin Group. Lewin
Yeah.
Group. I mean, can you just talk, just before we go on, another aspect of the story, just talk about that, because that was very surprising.
Yeah, I think it was around 2008, although that date might be wrong, where they bought a think tank, the Lewin Group, and have since obviously poured a lot of money into it and been able to appear kind of removed from very influential lobbying efforts or kind of reforms that are made on the Hill, and then also at academic institutions. Yale, I think, was one of the more recent.
Surprise billing legislation helped influence that.
Yeah, they ended up being funders, and it was not initially disclosed. So they have found ways through, purchasing think tanks to maintain very close proximity, if not like full influence, on where lawmakers are being educated around these problems.
And you also get into a lot of different scandals that throughout the course of the company, and some of them kind of hit home that, look, I mean, it's a for-profit company. I mean, they're trying to make profit, but, sort of get at a little bit of the culture of the place. Can you talk about some of the scandals that you highlight throughout the story, and how you see them fitting in with, like, okay, this is the kind of culture that they had?
Yeah. Again, I'll start, and Sarah, you can fill in. But I think before I actually get into some of the specifics of the scandals, what was interesting to me in this research was finding that the heads of the company throughout each one of those periods of kind of malpractice would either step down and say the chairman would take over as CEO, clearly kind of another player in some of the deciding or decisions being made at the time, and remained parts of the board until the founder, Richard Burke, who obviously was there throughout all the scandals, stepped down just in 2022. So they haven't, when you think of something going through very serious allegations or a company going through very serious allegations, oftentimes there's leadership turnover. And I would say what could appear as turnover was very rarely the case. But a few of the scandals that I think are noteworthy, which some of you may know, I would say the most notable is in the mid-2000s with Ingenix, which was a database used by rival insurers. It was the most widely used database to set the out-of-network payment reimbursements, where they were supposed to cover roughly 80%. And it was found by Cuomo, actually, that they were completely under reimbursing to the point of, I don't remember the exact number. It was maybe they were supposed to be paid like $200. He gave one example where they were supposed to cover roughly $200 and paid $60, just claiming that was the 80%. And it was so egregious to the point where, every other insurer that used that data set was also being fined by various states and by patients who were not covered or appropriately covered. However, what the remedy was, which was for them to create this nonprofit, it completely fell flat in its efficacy. And we saw the basically recreation of Ingenix with Multiplan, and then now more recently with Navigard, which is United Health's version of this again. So kind of a rebirth of United controlling what the out-of-network reimbursement rates are. And as we've discussed, there are lawsuits where that is often and almost always underpaying what claims are being sent. There are many other, I would say you should read our piece because there are a lot of pretty ridiculous examples of malpractice, but if you want to give another.
No, I was just going to say that something that was interesting, a theme that I think we saw throughout the scandals and throughout the lawsuits that United Health has, and allegations that United Health has faced since its onset, really has been through these fights with physicians, with providers. From the very beginning, so much of United Health Group's mission and model has been surrounding this managed care, or what's sort of been redefined as value-based care, that is really about controlling the provision of medicine. And all of the scandals dating back really have so much to do with that theme. And it's not just about under reimbursing doctors. It's also about controlling how they decide, or how patients can continue to receive treatments and the prescriptions that they need. And that's what's really frightening about this company, and about really the big insurers as an industry as a whole, that have gone on to sort of copy United Health's model, is the way that they are controlling what physicians do and what patients have access to.
And I kind of wanted to get your overall take, having done this history and just kind of getting a sense of how things are now. I mean, policymakers, obviously this think tank was promoting this idea that, United Health is part of the solution here. This vertically integrated care can efficiently provide better care at lower prices. But now, obviously we heard this morning, DOJ is concerned about this type of vertical power and conglomerate power. there's a FTC 6B into the PBMs, which are, again, United Health owns one. Actually, two different 6Bs into the PBMs and their PBM aggregator, entities. I don't like to call them GPOs. That confuses me.
I know.
So I call them rebate aggregators. But, do you get the sense that United Health at this point, obviously the DOJ sued them when they ultimately successfully bought Change, is regarded as a problem, not part of the solution now? Or do you get the sense that actually like that prevailing kind of idea still kind of exists among policymakers? I'm just concerned as part of the history. We got the weird evolution of Ingenix, where we got Ingenix and coming back, and now they're doing the same thing. It doesn't seem like they really learned the lesson there, or even the lesson from MultiPlan being sued so many times. I mean, they just doubled down. It's like, yeah, we'll do it ourselves. Like, I guess you can sue us. But what's your view of how DC and AGs and law enforcement and policymakers now view the company after your report?
Yeah, I think the biggest issue that we're seeing a lot of lawmakers and state AGs get interested in is really in the pharmacy benefit manager section. There's a lot of concern about the conflicts of interest that are inherent in the PBM model and their role in driving up prescription drug prices and limiting the prescriptions that patients can have access to and blocking generic drugs from the market, under reimbursing independent pharmacies, leading to pharmacy deserts, which I'm sure we'll hear a little bit more about this afternoon. I think that's really the area that we're seeing a lot of interest. I would love to see more interest in the inherent problems of vertical integration between insurers and doctors combining under the same roof. I think that's something where there needs to be a little bit more education and interest from law enforcement.
One thing I will say is, we recently saw a letter from Elizabeth Warren's team addressing the potential harms of the Amadeus merger or acquisition, really, of United. And the letter itself actually went into a much broader problem of United and how large it is and its influence over the entire healthcare system. And there were a few other senators who signed on to that letter. So I do think that people are beginning to at least have teams that want to educate themselves on this like broader consolidation problem in our healthcare system and with the insurers' roles in that specifically. But as you all know, and I've recently learned, it's so the industry as a whole is incredibly and almost intentionally confusing. So I think it's hard to grapple until you pick off a few pieces like PBMs. It's hard to grapple with the entire structure of how do you actually address this problem. And given we have kind of gone down this path for so many years of doubling down on using these large players, like just during COVID, United gave out $150 billion from HHS to independent providers because they just had all of those connections. So we continue to allow them to have as much control as they do, but I think, I would say there are some bright lights of people and, people on the Hill wanting to dig into it beyond the smaller pieces.
Okay, we got to wrap up really quickly, but I wanted to ask if has AALP taken a position on the Amedisys merger at all, or if you looked at that, and then also just AALP work in this area? I think I saw a toolkit. I mean, I was getting ready for this conference, so I know we wrote about it and I read about it, but maybe you can tell us a little bit more quickly about that as well.
Yeah, I mean, we should have our manager who is giving a talk about the toolkit itself. Also, anyone who wants to be more educated on the state side of how you can address it, go talk to Eric. But I guess, Sarah, you're the most well equipped for this one.
Yeah, I think we are looking at it through a few different prisms. One, there are these big acquisitions and mergers that are going on, like the Amadeus merger, that we most certainly, given the conflicts of interests in an insurer owning a provider, would oppose.
And wait, one thing to chime in there, also just their clear interest in it now that the government has announced kind of funding a lot of home health advancements. So I think there's a connection there. But
Yeah.
continue.
And then so there's the sort of individual advocacy against certain mergers and acquisitions, but then there's also the policy approach in terms of what Congress can be doing. In terms of what Congress can be doing, in terms of what the Federal Trade Commission and DOJ and state legislators. So we're sort of trying to take a little bit of a broad approach, but certainly for individual large acquisitions like that, that's something that we're actively trying to oppose.
Yeah.
All right, perfect. Well, thank you so much for doing this.